My name's Nadine Perlen and I'm the Clinical Director of Lockridge Medical Centre. We'd like to share with you some information about the current situation with COVID-19 infection in our community and how we're managing that at our medical centre. So the current situation in Western Australia as of today is that there are 460 cases and sadly there have been 4 deaths. I think we need to keep this in perspective with the world situation and be very grateful for where we are and the low incidence to date. And that has been partly due to our situation and our isolation, but also the measures that have been put in place and the community response to that. We've put in place a number of changes at the practice in how we look after you and keep our place open and running. And I'd just like to talk to you about that and explain to you what we've done and what you might expect when you come to the practice. So when you call our practice to make an appointment, you will be asked some questions to check whether you are potentially infected or at risk to others. When you arrive at the practice, when you come in downstairs through our entrance, you'll be greeted by some of our staff who will ask you those questions again and also ask you to sign a declaration. We've made a decision to put this in place to keep all of our patients and staff safe and to ensure that we can continue to stay open and providing a medical service to our community. We need to ask that everyone comply with our measures that we've put in place and understand that our staff are carrying out our management decisions. There will be zero tolerance for any mistreatment or abuse of our staff, and you would be asked to leave the practice in this situation. We've implemented a lot of changes at the practice, and now many of our consultations are being conducted through telehealth. At the moment, for us, that means telephone. We don't have video systems in place at the practice, but we are hoping to be able to implement that soon. So when you call, depending on what your problem is and what your personal situation and risk is, you will be offered the option of having a telephone consultation with your doctor who may be at the practice or who may actually be working from home. These consultations will run in the same way as a normal consultation, but obviously being over the telephone, there will be some differences. We can't examine you over the telephone. We also would ask, in the situation of a serious medical problem, something that will require examination, or if there are speech or hearing issues, or the patient who needs to be treated is perhaps confused or needs a carer or an interpreter. Those situations may possibly need to be seen face-to-face, and we are still conducting face-to-face consultations at the practice as long as people don't have any signs of infection. We are also starting up tomorrow our flu vaccination clinics. To access these clinics, you will need to call and make an appointment for the flu clinic. The flu clinics will be conducted in the area underneath our practice, and we have set things up to keep everyone safe in those areas. At the moment, general practices are not doing COVID testing. COVID testing is all being done at Health Department COVID clinics, and if this is required, on discussion with your doctor, you will be directed to one of those clinics. We realise that everyone has had to undergo a lot of change to their lives. All sectors of society have been affected. Many people are home now, either working from home or unfortunately may have lost their jobs. There are many parents at home now having to homeschool their children and manage their work at the same time. These are massive changes that none of us have ever had to deal with in our lives. We hope that you all stay well, that you adhere to social distancing, and that if you are at particular risk, that you isolate yourself as you've been advised. We do encourage you to stay active, to eat well, to have strong immune systems, and to try to get out where it's safe to do so, to do some exercise every day. So we're here. We plan to stay here and be here for you, and we look forward to continuing to work with you through this very, very difficult situation.